Hello everyone, I am back to my channel Learn Optometry. I am here with another topic, Aphakia. So let's get started. Hope you all like the video and you may get something to learn from my video. So here it is. So what is aphakia? Aphakia means absence of crystalline lens from the eye. This is our eye. The position of lens is here. Okay, the absence of crystalline lens from its position, from its normal anatomical position to the pupillary area, means the lens shift, means the lens dislocates from its normal anatomical position to the pupillary area. This condition is known as aphakia. Okay, so optically we can say that aphakia means the absence of crystalline lens from its normal anatomical position to normal anatomical position in the pupillary area. So let's see what are its etiology. Etiology is cause, means why it happens. So first etiology is congenital. Congenital itself means by birth, and it is very rare, means the condition aphakia is very rare to the patients by birth. Okay, next is acquired. What does acquire mean? Acquire means acquire stands for, means it happens to the person, means it is acquired by the person by some incidents or by some happening to them. So acquired, it may be post operative, pre-operative, or post traumatic. Okay, yeah, post inflammatory, it may be anything. So first is surgical aphakia occurring after removal of lens is the most commonest one, means it is post operative, means after the operation, means after the surgical removal of lens, the condition is known as aphakia. So surgical aphakia, it is the most commonest one. Next is aphakia due to absorption of lens matter is noticed rarely after trauma in children. Means in some children, if there is any trauma, then aphakia due to absorption of lens matter, means the lens matter absorbs the condition aphakia. So it is one of the reason. And the third is posterior dislocation of lens in vitreous causes optical aphakia. Means in the optical aphakia, the posterior dislocation means the lens dislocates posteriorly. Okay, so the posterior dislocation of lens in vitreous causes optical aphakia. So that's it for about the etiology of aphakia. Now let's see the optics of aphakic eye. Now let's see the optics of aphakic eye, means what are the changes after the removal of lens to the eye of the patient. So optical changes occur after removal of patient. So let's see what are they. First is hypermetropia of high degree, means if there is the removal of lens in patient, so the patient may suffer from hypermetropia. Okay, hypermetropia is high in degree. The patient will suffer from hypermetropia. That means the patient must possess positive power after the spectacle correction. Next is total power of eye is reduced to about plus 44 to from plus 60, means that normal power of human eye is plus 60 diopter, and after this condition, after the removal of lens, the power shifts to plus 40 diopter. Next is anterior focal point becomes 23.2 mm in front of the cornea. Actually the normal anterior focal point of the cornea is 15.7 mm, but it becomes 23.2 mm in front of the cornea. Next is posterior focal point is about 31 mm behind the cornea. The posterior focal point becomes 31 mm behind the cornea. I don't know the exact normal position of this posterior focal point. And the last one is accommodation is lost fully. The person may not be accommodate fully, means the person may not perceive the full accommodation. Now coming into the clinical feature, what are the clinical features? So there are two clinical features here. First one is defective vision. Main symptom in aphakia is marked defective vision for both far and near due to high myopia and absence of accommodation. So what does this mean? Defective vision means that patient has some defect in seeing the object around him or her. So the main symptom in aphakia is marked defective vision. Main symptom is defective vision, means the person is not able to see clear for both far and near. The person is not able to see both far and for near due to hypermetropia and absence of accommodation. The person loses the accommodation, as I have taught you. So the person may suffer due to high hypermetropia and absence of accommodation. Next is symptom is erythropsia and synopsia. What does this mean? This means seeing red and blue images. Seeing red and blue images due to excessive UV rays, ultraviolet rays, and infrared rays in the absence of lens, as there is no lens present there due to the condition aphakia. So this happens due to excessive ultraviolet rays and infrared rays in the absence of lens. Now let's see what are the signs of aphakia. So the first one is anterior chamber is deeper than the normal. In aphakia, anterior chamber gets deeper than the usual. Second is pupil is jet black in color. The color of the pupil turns into jet black. Next is vision, only finger count at 2 to 3 feet. Uh, while testing the visual acuity of the patient, when the doctor ask when the doctor will ask how many finger is this or this or this, the patient will only see the fingers at 2 to 3 feet. Next is Purkinje image test shows only 2 images, normally 4. When you will check the Purkinje image at patient's eye, in patient's eye, then you will show only 2 images will be there, and but normally there are 4 images. Next is retinoscopy and autorefractometer. In this, it reveals the high hypermetropia. And the last one is iridogenesis. What is iridogenesis? Iridogenesis is a condition in which iris vibrates during eye movement. So these are the signs of aphakia. Let's see what are its treatment. How can we treat the condition aphakia? So for correcting aphakia, it includes 4 conditions. First is spectacles. You can prescribe spectacle to the patient, contact lenses, intraocular lenses, and refractive corneal lens surgery. So let's see one by one how it works and how can we treat the patient of aphakia. So first is spectacles. Spectacles. 2 separate glasses are given for both distance and near vision. As you know that for distance vision, doctors prescribe the patient different power, and for near vision, you may prescribe the patient the different power. So two separate glasses are given for both distance and near vision. Okay, bifocal glasses are usually troublesome. Doctors do not prescribe bifocal glasses because most of the patient cannot tolerate it. Okay, so if the eye is previously emetropic, if the eye has no refractive error, emetropia means no refractive error. So if the patient has no refractive error earlier, the power will be approximately for distance vision it will be plus 10 diopter for spherical, and for cylindrical it is plus 2 diopter at 180 degree. Okay, for near vision it is plus 13 diopter in spherical and plus 2 diopter at 180 degree. So as there is loss of accommodation due to absence of lens, a plus 3 diopter spherical addition is given for near vision. So as you know that we prescribe plus power for the near vision, so plus 3 diopter spherical is given for near vision. The comfortable reading distance is 33 centimeter. Now let's see what are the disadvantages of prescribing spectacles to the patient. So first is image is magnified by 30%, so not useful in unilateral aphakia. So for unilateral aphakia it is not very useful because image is magnified, image gets larger by 30%. Problem of spherical and chromatic aberration of thick lenses. The patient get problem with spherical and chromatic aberration of thick lenses. Next is field of vision is limited, means the patient cannot see the patient cannot see the object at a far distance, or means there is a limited field of vision after prescribing the spectacles as well. And last is prismatic effect of thick glasses. As you prescribe the patient's thick glasses, there is a prismatic effect, means the images which patient will show will not clear and will not clearly visible to the patient. Now let's see the another type, contact lenses. So there is advantages of contact lenses as well as disadvantages of contact lenses. So let's see. Less magnification of image. As in previously we have seen that in spectacles, the disadvantages was that uh, image form is magnified by 30%. In this, the advantage is less magnification of image. The image is not magnified much. Okay, elimination of aberration and prismatic effect of thick glasses, cosmetically more acceptable and better suited for uniocular aphakia. So, and its disadvantages are, it is more costly. Okay, it is more costly, cumbersome to wear, especially in old ages and in childhood. I mean, it's difficult to wear. And last is corneal complications associated. Okay, there may be some corneal complication after wearing contact lenses, and it is very cumbersome, means it is very difficult to wear for a child, for children, and for old ages. Next is intraocular lens implantation. So it is the best available method for correcting aphakia. So intraocular lens implantation is the best method to correct the disease aphakia. Okay, primary intraocular lenses implantation is done during cataract surgery. Means when the patient is treated with cataract surgery, means the doctor implant the intraocular lens at that time, at very that time. Okay, next is secondary intraocular lenses implantation is done in already aphakic patient. Okay, implantation is already done in a aphakic patient. Last one is refractive corneal surgery. So hyperopic LASIK may be tried in case where secondary intraocular lens cannot be implanted. Okay, hyperopic LASIK is tried in this case, and secondary intraocular cannot be implanted in this case. So that's it for aphakia. In next topic I will teach you the topic pseudophakia, which is related to aphakia. So hope you all like this video and you get to learn something. If you have any doubt, then please write down in the comment section, and you can also write which topic you want to study in the next video. Okay, thank you, take care.